As Program Director of the Total Joint Center at the Miriam Hospital, I'm gratified to be celebrating now 10 years of restoring our patients to ease of motion, freedom from pain, and an improved quality of life. Since 2011, when our first patients received hip, knee, or shoulder replacements, our surgeons have now performed more than 15,000 total joint replacements. A decade ago, patients could expect to stay in the hospital an average of 3.5 days. Now, most go directly home within a day of their surgery. Our clinical excellence has been acknowledged time and time again. The Total Joint Center consistently performs better than the national average in clinical outcomes and patient experience, with lower rates of infection, fewer readmissions, and a quicker return home after surgery. The Total Joint Center earned the Joint Commission Gold Seal of Approval and was named a Blue Distinction Center Plus for knee and hip replacement by Blue Cross and Blue Shield of Rhode Island. In addition, U.S. News and World Report has awarded the Miriam Hospital a high-performing ranking for both hip and knee replacements. Our skilled surgeons, OR teams, talented therapists, and dedicated nurses are the heartbeat of our patient-centered program. As I like to say, we're not just a total joint center, we're a total care center. With continual advances in total joint replacement, we look forward to a bright future of guiding thousands more patients back to freedom of movement and the daily activities that give their lives purpose and joy.